Certainly there have been quite dramatic changes in drug discovery in the pharmaceutical industry. It was very much an idea of chemistry-led approaches back 20, 30 years ago, where you started out with a lead compound and moved it through the process of development. The problem with that was that it did not allow for a lot of exploratory research. It meant that you had to go to the academics to do the exploratory research. Now this is something that was kind of interesting with the 5-HT3 stuff, because that was pretty much industry-led at that time. But most of the projects that were moving along that time were along the chemistry-led idea. Start out with a good lead compound in an area where you have some level of confidence that you may show efficacy, move it up to a very selective and specific compound that's quite potent. The problem with that, again, is that it just does not allow the exploratory work to be done. And what you really have to do, and what I've maintained for quite a number of years, is that in order to get something that is, come up with something that's good, you have to understand the normal physiology first. If you don't understand the normal physiology pretty completely, how can you ever hope to understand where the pathophysiology is, coming from? But because the industry at the time was very keen to fill the pipelines and to keep the shareholders happy, you had to be able to say, our pipeline is constantly being filled. We're constantly bringing this whole new concept idea up and moving. What happened through a number of pharmaceutical companies was you started getting huge attrition of compounds failing. And it isn't only that the compounds were failing, it's where they were failing. Now, you do your phase 1 studies, you get an idea of what's going on in humans. You do phase 2 studies and you start getting efficacy. Then you move into phase 3 studies, which will carry on and increase your patient numbers. What happened probably in the late 90s, certainly 2000, was that you were getting compounds progressed up to phase 3, and 60% of the phase 3 compounds were failing. That's very expensive, and no one can keep up that amount. So the whole business model was going to have to change. It had to change, and that's probably the biggest thing that's happening now. You've seen mergers of the large companies because they got to get their money together anyway. And additionally, even the larger companies, they're not doing their own research. As far as I understand anymore, it is tending to be contracted out. So you're getting smaller companies coming up with ideas, moving those ideas forward until it looks like, yeah, this is a pretty good way to go forward, taking kind of the initial risks, and then this moving into the big pharma companies where they would take it on. How successful that will be, I don't know, because these things are just getting harder and harder to do. But more than anything else, anybody getting into this area now, I think it's absolutely keen and absolutely essential for them that they get a terrific understanding of what's going on normally in physiology and pharmacology. And until they do that, they're just not going to come up with the goods, basically.